Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi, and welcome to the Bee's Knees podcast. This is your host, PJ Ewing. I'm really glad you're here with me today. I've got yet another very short and sweet podcast. This is a companion piece to the other podcast that we had with Dr. Michael Moon, a pathologist, who was going into great detail about knee surgery and recovery at the cellular level in the other podcast that goes with this. And in this case, we go into what happens if you have a real problem on your hands. You genetically or for whatever reason have the tendency to create what are called hypertrophic scars or keloids, also sort of an intense fibrosis in the knee, which makes your recovery just miserable, or at least, alarm bells are going off in everyone's monitor when you come in for rehab because you're going to be a problem kid when it comes to recovery. Dr. Moon explains in great detail what the nature of keloids, hypertrophic scars are, and how you can tell if you've got them, and what kind of problem do you really have if that's going to be you when it comes to recovery from, in this case, knee surgery. Dr. Michael Moon, pathologist, all about hypertrophic scars, keloids, and scar tissue.
So in the normal organism, normal tissues, you have a combination of collagen and elastin that allow movement and also stability. Collagen more for stability, elastin more for malleability or movement. So when you have injury, you end up with fibrosis, the result of fibroblasts laying down collagen to repair, but you do not have replacement of the elastic fibers that you had previously. This differs in different people to a greater or lesser degree, and what we're talking about then is basically scar formation. When you have the collagen laid down by the fibroblast, you're forming, in quotes, a scar. You can see the results of that on skin, and it also takes place anywhere in the body after injury. Now, as I said, different individuals have different capabilities in terms of this repair. When we see it on skin, we may refer to it as a scar. If the individual has a exaggerated ability to do this, to lay down collagen, to lay down a reparative fibrosis or scar, you can get what we refer to as hypertrophic scars or keloids. And these can be seen on the skin, and you can tell if an individual is more likely to form a hypertrophic scar or keloid when it's beneath the surface from surgery. You cannot necessarily recognize this as easily. However, they all have some of the same effects. As I alluded to earlier, they do not contain elastin fibers, and so you have some decrease in the resilience, the malleability, or the ability to move the area, and particularly when we're talking about a joint, that is can be of some concern. Pathologists, we can tell the difference between those two microscopically. Other than being able to do that, it's really not of importance because they have the same effect. If the person now, if you have a very intuitive physician that notices a scar on the surface of the patient, they could be tipped off. Oh, this person forms keloids. They are more likely to have an exaggerated fibrotic response. And so this is something to be looked out for. And like I say, if you're once you've seen it and you see it on a person, then you know that it's a keloid. And it's a difficult problem more cosmetically a lot of times for individuals, because you try to remove the keloid, then is anesthetic, and more so than a normal scar. And so you try to remove the keloid, and they form another keloid, because it's their tendency to form this exaggerated fibrotic response. You can see it microscopically by taking biopsies and looking at the individual cells and the amount of collagen that is present and the orientation of that collagen microscopically, particularly if you have a frame of reference, for example, the skin surface, with respect to the skin surface, how that collagen is being laid down. But you can also see it clinically by symptomatology. How stiff is the region, how stiff is the joint, or how movable it is, how movable versus stiff, immovable the joint is. You can get an idea as to how much that fibrosis or scarring is progressing, to what degree it's progressing. And to me, it's a clinical judgment, and something that clinicians can do because of their experience with patients.
And that's it. Thank you, Dr. Moon, for a really interesting explanation of keloids and hypertrophic scars. I think if you listen to this one as well as the previous episode in which Dr. Moon goes to the cellular level, I think you have a really good handle of what's going on inside that knee. That's the end of our series, our 7-part series, 7 podcasts in 7 days. I hope you've enjoyed it. We will get back to some longer form pieces coming up next. I think we have a full interview with a patient coming next, with Mary Elliott doing that in the next installment. Thanks for listening to all this stuff. If you have comments, it's thebeeskneespodcast@gmail.com. You can always go to x10therapy.com for more great stuff that you might not find in the podcasts. We have all kinds of video content there, lots of education. And then there are 2 email series that you might consider joining. They're free. One is called Knee Recovery Basics, and that's really for people that are having some difficulties, but they're not out of the woods yet, but need a little advice. That's a great series. And the other one is Prehab and Pre-Surgery, which is preparing people for knee surgery and knee replacement. Those are both available. If you go to x10therapy.com, go to the homepage, which is where you end up when you do that, and you go to the bottom, and there are 2 places where you can just sign up for those email series. And also, if you're interested in joining the conversation that we've created on our website, you can also find links to some terrific Facebook groups, private Facebook discussion groups, knee surgery, recovery, and rehab. We have a group on revision surgery, one on manipulation under anesthesia. We have one called the Crucial Cruciate. Yeah, I named that one. That's about ACL, PCL, a variety of ligament problems that people have. We've got a patellar fracture private discussion group as well. Just email us if you have any questions or have any trouble finding any of those private groups. Again, the Bees Knees Podcast @gmail.com, and I'll help you with that stuff if you can't find them. Thanks for listening to the series. Looking forward to seeing you again next time.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.